Okay. So basically, integrative medicine, the definition, I think last for the previous talk, we talked about what's the definition of integrative means combination of Western medicine means modern medicine and traditional Chinese medicine and etc. Even others alternative medicine, for example, homeopathies, nutritional therapies, and etc. So as to provide a holistic care to the patient. So this is a multidisciplinary approach to take care of our patient. So today's topic is in stroke management. I think stroke is a very hot topic in the whole world now, even. So stroke, I think every day happen in surrounding us. Maybe we have sometimes we have heard about our friends or a relative or others to get stroke. Yeah? Even nowadays, a lot of young people who got stroke in a young age. Not this stroke is no more elderly illness. Now even the stroke even in early teenagers as well. So today our objective is to share the combination, the benefit of integrative among TCM and the modern medicine in stroke management to improve the quality of life and reduce the risk of the recurrent stroke. Yeah. Why we say recurrent stroke? I think nowadays a lot of people's even the stroke patient who have second stroke, third stroke, fourth stroke, etc. Because I think many risk factors to cause current stroke. Yeah, many factors. Later we will talk about it. And then once recurrent stroke, the condition will be worsen. So recovery rate will be more difficult. So, okay. Next. Okay. Okay. We cannot go down to we cannot go down to next page. Okay. How to go down next page. Okay. So we this diagram you can see the worldwide death rate from stroke and the coronary heart disease. Stroke normally related to the heart disease and hypertension. So we can see from this graph, we can see Malaysia. Yeah, Malaysia. Stroke death rate per 100,000 person per year. In Malaysia, is about 80 over 100,000 person per year. Death due to stroke. It's not we here is not is not including those survivor from stroke. It's death from stroke. So there are many patients die in the hospital, unable to come out from the hospital due to stroke. Those who can come out to see, for the rehabilitation or for physiotherapy or for TCM, those who consider survivor. Yeah. So I think a lot of patients don't know about stroke can cause death. You may see, 80. Somebody can mute your mic, please. Somebody, hello, NYX. NYX, please mute your. Okay, thank you. Okay. What about China? You can see China. China is 160 person people per 100,000. You see, even China. But of course, in USA, in UK, less than 50. But of course, here we can't see what are the factors to make China so huge, so many people die from stroke. Yeah, even Korea, you see, Korea also very high death rate. India, even India also very high. Uzbekistan, Kazakhstan, yeah. So for Southeast Asia, Malaysia, Indonesia, and Thailand, almost the same. So I think from this diagram, I think most likely we can see the developing country. But of course, Korea is a developed country. But you see, developing country is slightly higher death rate. Maybe due to the stress, because everybody fight for the financial, and others like Europe country, everybody very relaxed, working hour less hour working hours. So that's why maybe due to less stress, maybe one of the factors will cause death rate from the stroke.
Smartphone connected.
Sorry? Hello? Another things maybe because of the compliance of the medication, compliant to the treatment for the hypertension and the heart coronary disease as well. Okay, next. So type of stroke. I think most of us, we know the types of stroke. There are two types, yeah, ischemic stroke and hemorrhagic stroke. So ischemic means blocking, blood clot, blocking the blood flow of the brain vessel. So once the blood flow in the brain is blocked, then no more blood can go further to nutrients the brain cell and cause brain cell death and cause stroke. So hemorrhagic means bleeding due to the burst of the vessel, brain vessel, bursting. The vessel burst. So burst, then the blood will come out, go out from the vessel and invade and prevent the blood go further to nutrients the other parts of the brain. So this will cause stroke as well. So there are two main types of stroke: ischemic and hemorrhagic. Why we need to need to differentiate these two stroke? A lot of people, many patients come to see me and they will say, "Oh, I have many ways. I have this kind of ways to cure the stroke and help the stroke patient, or maybe I give the blood thinner to the patient to prevent stroke." Yes, it's not fully correct as well. So I think the most important, when you found somebody got stroke, maybe there is a symptoms of stroke, but first of all must know which one first. Yeah, must know whether it's blocking or bleeding. If not, because the treatment actually is different. Treatments for ischemic, of course, is to unblock the vessel. Bleeding, of course, the most important is stop bleeding. Yeah. So I think first of all must know how to diagnose the proper diagnose to have a proper diagnosis of stroke first. Of course, symptoms of stroke, I think everybody know, face, arms, legs, or weakness and numbness, confusion, and trouble of speaking, slurring of speech, or difficulty seeing, blur of vision, and trouble walking, everybody know. Yeah, risk factor, of course, hypertension, diabetes, smoking, obesity, and heart disease. Family history as well of stroke, and age over 55. I think everybody seen this fast for stroke. Yeah, fast means is how we come together to end the stroke. Yeah, there are many Ministry of Health try to encourage everybody to know this. We must act fast when we see patient who have got who is getting stroke. So how to know first? First, face drooping, F for face drooping. That means weakness of the face muscle or one side. normally one side. No stroke to cause both sides of face. And then A is arm weakness, means one side of arm or both sides of arm weakness as well can hint stroke as well. And speech speech difficulty. I mean, want to speak out, very difficult to speak out, and also you're unable to understand what he's saying, very blur, very unclear sound. And then, of course, T is time to call Malaysia 999. Don't wait. Yeah. A lot of people say, oh, I have many types. Or I can click the fingertips. I press the some acute point. And I snap the elbow joint. Many, of course. I mean, many patients told me so. I would say no harm to do so, can do. But the most important, while doing this, but must call first. Call for help. Call for help. Of course, don't wait. Even the patient or maybe improve after doing flicking, finger flicking or any pressing. Yes, very good. It's a good sign, but don't delay. Don't delay. Go to hospital. Must send to hospital immediately to have a thorough checking. We must find out, because what we worry is to have a recurrent stroke. Yeah, means repeat second stroke. Second stroke for some patient can happen within 7 days. A lot of cases, especially elderly, maybe they have a first stroke at home, but they did not inform family members, because they recover from the first stroke. They fell down inside the toilet or inside the room or a bedroom, or they fell dizzy a bit or some weakness a bit. But after that, after resting, then they feel better. Then they did not inform family members. So that's why they didn't go for the thorough checking. So that's why they already missed the golden period to treat the stroke. So here I try to emphasize that every patient or everyone, when you know somebody is who has stroke, or stroke symptom or complication, must go to hospital, have a thorough checking to find out what are the causes or what are the risk factors to cause stroke. First thing. So of course, risk factor, there are many. Those who have hypertension, high blood pressure. So hypertension must control, must have a very well control. A lot of patients don't care at all. Even they have hypertension, they come to see doctors, then they know that, I have blood pressure. They even don't know because they have some symptom already, but they ignore it. Of course, obesity. Obesity is a very common problem, especially in Malaysia. Obesity also is a main factors to cause many illness. High cholesterol. High cholesterol is still not so urgent. I mean, normally we can improve by diet control. Yeah, high cholesterol. But of course, for some family history or from genetic high cholesterol, that one must be undergo treatment. Of course, heart disease, cardiovascular disease is a big issue, big issue, especially atrial fibrillation and valvular heart disease because of valve, the heart valve problem, or some arrhythmia. Dysarrhythmia means the irregular heartbeat illness also can cause stroke. Diabetes, I think diabetes is the main issue in Malaysia to cause stroke. Diabetes is very very serious, because very hard to control in a well control, but of course need a lot of cooperation between patients and doctors to work out to really make it well controlled. So diabetes is main risk factors.
The
And of
doctor
course,
give a
smoking,
whether
drug use.
the person who got stroke, should they combine the Western and the Eastern treatment method?
What? Oh,
The you know.
I see. Your question is whether should we to combine Western and the traditional way to treat patient? Is it? Is it your question? Hello. Later we will talk about this. Yeah. So, okay. Next, heavy alcohol. Of course, alcohol we know lah. I mean, small pinch is okay, but not drunk lah. Not go until drunk. So heavy alcohol. Next is sleep apnea. I think a lot of people don't know about this. Sleep apnea means OSA, obstructive sleep apnea, is a severe sleep problem to cause hypertension, uncontrolled diabetes, even cause stroke. So if you have snoring, severe your even small kid also having nowadays teenager or elder also have very severe sleep apnea, especially the obesity. I mean, those who are obese. These must treat properly to prevent stroke, because a lot of stroke happen while sleeping. Then once they wake up, they feel, how come my one side hands, arms, upper limbs and lower limbs cannot move? Because of sleep apnea. Yeah, of course, lack of exercise. We must do more exercise. Yeah. Okay. Okay. Next, I think the types of the stroke. There are two types: bleeding and blocking. Okay. Now there are some another types of stroke. I think we need to know transient ischemic attack. We call TIA, mini stroke. So this is as I say just now, a lot of elderly, they fell down or they feel dizzy on bed or fell down in the toilet and they recover from it. Normally, they have the TIA. So this is transient ischemic, means for the short term, just the blockage for the short term, and then they recovered naturally by itself. Yeah. So after that, then they feel better. Go back to normal condition. So they thought, oh, maybe just dizzy or some other problem to cause them dizzy or some weakness. So they ignore it. So I think TIA must be put it very important in our mind. Yeah, TIA. Because once you have TIA, so you may have second stroke already. If TIA considers stroke, first stroke. So you may have very high risk to have a second stroke within 7 days. So that's why when we interviewed our patient, normally they have this history, TIA history. Okay, so next types of stroke is brainstem stroke. Brainstem is even serious than the brain vascular stroke. Brain vascular stroke means the small vessel or big vessels of bleeding or blockage. But brainstem means in the middle of our spine, in the middle of our brain. So brainstem is control a lot of things. Brainstem control their 12 we call cranial nerve. Many things to control, even our swallowing, our speaking, our breathing. So that's why some serious stroke can cause death because of brainstem stroke. Brainstem and bleeding or blocking and stop the bleeding. The patient unable to breathing or unable to speak, unable to swallowing. So all this is brainstem stroke. Yeah, it's very serious. So next is cryptogenic stroke. Cryptogenic is unknown cause. Some patients, why they have because of irregular heartbeat, as I say, dysarrhythmia means the heartbeat, irregular heartbeat. A structural problem in the heart is valvular heart disease, means the heart valve cannot close properly or cannot open properly. So artery hardening, genetic or blocking disorder, blood clotting disorder. So this also can cause stroke. Okay, next we can see how to control the hypertension. Here we can see in the systolic BP, 10 millimeter mercury means if we can bring down the systolic BP more than 10 millimeter mercury, or the diastolic BP more than 5 millimeter mercury lesser, so then we can reduce the stroke risk more than 35%. Yeah. Here I want to emphasize that a lot of patients, when we deal with the patient with the blood hypertension, they only see the systolic pressure. They only see 140 above 140, wow, very high already, or 160 even high, 180 must go into the hospital already. They always see the systolic BP, but they miss the diastolic BP. Actually, diastolic BP higher, even more risk than the systolic BP high. You know what I mean? So the diastolic is the second reading. Not say second. One is 140, and below is diastolic is 90 or 80. Normally, that is considered diastolic BP. Diastolic BP, normal diastolic BP is below, is from 60 to 90. Cannot too low, cannot too high. It's from 60 to 90. It's a normal diastolic BP. But some patient, the systolic BP is 130. Whoa, normal. They thought that, I have very good BP, 130, very good. But actually, the diastolic BP is 100. Actually, he has a very high risk to get stroke because the diastolic is more than 100. Okay, so that's why you see we must try to bring down even 5 millimeter mercury. You can reduce the stroke risk more than 35%. For heart disease, even 20%. So here is some it's normally for doctors to see. I mean, we can see the longer terms of BPV means the irregular BP control. We can see more complication. From very short term, you can see some clinical organ damage, heart problem, kidney problem. But if long term uncontrolled BP, even worse. The GFR will be low, means patient might go for dialysis. All cause of mortality may cause high death rate. Even microalbuminuria and the proteinuria means the damage of the kidney cell. A lot of patients say, come to see me, find out hypertension. But I mean, of course, when doctor to make a diagnosis of hypertension, so normally we hope patient compliance of the antihypertensive medication. But some patient will say, I don't want to, once I take this medication for whole life, I will spoil my kidney. When I take all this medication, it will spoil my kidney and liver. Well, I scared. I don't want to eat. Can or not. But I would inform the patient, if you don't take the medication, of course, we must see how serious of the BP. If very mild, of course, maybe can go through a diet control or some exercise. Maybe you can not to take the medication immediately. But for severe hypertension, uncontrolled, I think better you take the medication. If not, the hypertension, the high blood pressure itself will spoil your kidney, not the medication that will spoil your kidney. The hypertension itself will spoil your kidney, will spoil your heart, will even spoil your eye vessel, your skin, your brain, and etc. So next, this is this graph I want to see. Just let people, you all know some. You can see the morning surge. What does it mean, morning surge? Morning surge mean you are taking medication, you complying to medication, but the first BP you take you measure after just after waking up. I mean, you don't go out, don't up from the bed first. You measure immediately. You can see the morning BP is very high. When you see the morning BP is higher, is abnormal, so you must take care. You must be careful. Don't think, oh, because I have not taken the medication yet, so that's why, okay, don't worry. But you must make sure the morning BP don't be so high. If morning BP very high, please go to see doctor and find out what is the problem. Because from this graph, all the scientists show that if the morning surge is high, even you are on medication, it's very high risk to get other disease. Yeah. Okay. So modern medicine in stroke, I think a lot of people know, but a lot of people don't know as well. So what can doctor help in stroke medication management? I hope I can share, let everybody enlighten everybody. First, I think thrombolytic. Thrombolytic actually, this is drugs to insert into the blood vessel, try to dissolve the blood clot and restore the blood flow. But this thrombolytic treatment only, I think the window. What does it mean? The window? Window means you only can use this method better from beginning of the problem, beginning of stroke, within 6 hours. You cannot more than 6 hours. Some people, some country even 4 hours, 4.5, 4.5 hours. If more than that, that means once you got stroke, and then once you reach emergency department, more than 4.5 hours, the doctor won't use this method to dissolve the blood clot anymore, because there will be a lot of complication to use this method. So that's why I think the golden period. So that's why I urge everybody go to hospital immediately, as to give time doctor to decide whether to use or not use, because they also need to go through a lot of testing, whether you are suitable or strong enough. So that's why this is so-called thrombolytic treatment. Next is thrombectomy. This is called thrombectomy. You can see in the right photos, yeah, you can see some wire going to the vessel, and then you can see some like a stand, like a ring, a spring. Actually, this thrombectomy means we doctor we do the standing for the heart block. We know everybody, when you heart attack, so the doctor will insert a wire into the vessel, and then to unblock or take out the blood clot from the heart vessel. So actually, it's a similar concept. Thrombectomy means the doctor will go in, will insert the wires into the brain vessel, and then try to remove the clot. Yeah, but the window period, very important. Doctor only can do this if the patient got stroke. The window period only 6 hours. Some go to 24 hours, but the earlier you do this, the better successful rate and less complication. Yeah. So this actually is very, very effective treatment, because when you block, because of blocking, but for bleeding cannot. For only for blocking, for ischemic stroke, it's not bleeding stroke, it's not hemorrhagic stroke. So this also very important, very, very effective treatment. So Malaysia, especially Hospital Sedang, Hospital.
The kid.
Sorry. General Hospital. We have this type of
exercise now.
stroke neurologist. stroke specialist, standby for the stroke patient. Okay, so I think this is a very effective treatment, especially for modern days, modern medicine. So, but the window period is very short, 6 hours. So you must. So that's why I will encourage everybody must go to hospital. At least you have the chance to see whether you can use this or not. Of course, rehabilitation techniques means the patient been stabilized and can come out from the hospital, not lie on the bed and go away. Not that. So rehabilitation is to reduce all the complication. So, okay. That is not a treatment. Okay. So here you can see the early intervention equal to greater reduction in the cardiovascular risk or heart attack or stroke. So there are many risk factors: hypertension, diabetes, cholesterol. But you can see the graph. If without any intervention, early intervention, the curve is just go straight. The risk factor is go straight. The risk to get events goes straight higher and higher. So if you early intervention, you may save your life and reduce a lot of complication, of the illness. Here, I think a lot of people say how to manage the edema. What the edema means? Some people will take some hypertension medication, especially to prevent stroke amlodipine. Normally we say CCB. So it's a calcium channel blocker. So amlodipine normally will cause a mild swelling of both legs, both lower limbs. Actually, is a normal event for this medication. Don't worry. Some patient very worried. Wow, how to reduce my leg swelling? Is it a heart problem? Or to use other way? To use some Chinese herbal or use some medication to pull out the water from the urine. I think the first thing, first reduce the salt intake first, and elevate your leg. Try to lift up. Don't just only in sitting position, your leg just on the floor. Try to lift up a bit. Avoid standing for long period of time. Make your lifestyle modification like diet, regular exercise. Even when you are sitting, try to move your ankles, both angle, your toes, even your knees. You can do some exercise. But of course, some patient may use some compression stocking. Okay, go to the TCM. TCM, of course, this is acupuncture. I think worldwide known about acupuncture may help to improve the stroke rehabilitation. Acupuncture, I think most of the patients, once they're out from the hospital, they will go for acupuncture treatments. And even WHO, World Health Organization, will encourage and prove that acupuncture may help. Okay, of course, herbal medicine a bit controversial, but if you use the correct, use it in correct way or prescribed by a registered TCM practitioner, it will help. It will help to improve the blood circulation. But here I want to emphasize that because normally for ischemic stroke, doctor may prescribe. We normally say tiga serangkai lah. Normally doctors will prescribe aspirin. It's a blood thinner and hypertension medication and a cholesterol medication. 3 types. But so since the doctors, medical doctors has prescribed or aspirin or some use clopidogrel, all this blood thinning. So you must inform, if you want to take herbs, you must inform the TCM practitioner that you are taking the blood thinner, because Chinese herbal for blood circulation, to improve blood circulation and to reduce the sticky of the blood is quite okay. I mean, it's quite strong as well. Yeah. So why you must inform them, because at least let them know that they don't use too much all this kind of improved blood circulation herbal. Of course, ginseng won't. I mean, so you must inform in order them to reduce those.
Say bye bye.
Okay, so if not, aspirin and then some more all the herbals cause a lot of bleeding, even internal bleeding, and cause hemorrhagic stroke. Increase the risk. So okay, here's some maybe share how
very long and
how TCM practitioner to treat, or how they classify stroke syndrome of in TCM for the patient, for stroke patient. So normally we try to differentiate whether the patient have vein phlegm blocking the meridian. We call 风痰闭阻, means vein, because vein means is will cause some dizziness. That's why the patient will have dizzy. Phlegm means is some element to cause blocking of the vessel. So vein, phlegm together and block the meridian. So that's why the treatment strategy, normally we try to disperse the veins and resolving the phlegm. Yeah. Okay. The next is normally is the liver yang rising with vein, means the 肝阳上亢. Normally this kind of patient normally is a very bad temper, or maybe working under the sun, or maybe while arguing with somebody, then suddenly they got stroke because hypertension. Especially for men, for male. So liver yang rising with vein means 肝阳上亢. Normally this is uncontrolled hypertension, and maybe some stomach. They like oily food. Yeah. The next type of patient normally is qi deficiency with blood stasis. Normally for this kind of patient, normally is the heart problem. They may have heart cardiovascular disease. As I say just now, the dysarrhythmia, irregular heartbeat, valvular heart problem, yeah, or heart muscle problem, weakness. Qi deficiency means lack of qi, lack of internal energy. So that's why they will cause stroke, yeah, and cause the blood stasis. Next type of patient is yin deficiency with empty fire, means 阴虚火旺, means normally is so-called dehydration, or maybe some patient with lack of anemia. Yeah, yin deficiency. Yin means liquid. Yeah, so normally when yin deficiency relatively means our body lack of liquid, so slightly feverish will happen due to the yin deficiency. So normally this type of patient is they undergoes night shift or work night shift, their lack of sleep. Yeah, normally they may have this kind of syndrome. Next is phlegm heat obstructing the orifice. Means a lot of phlegm heat obstructing the orifice, means to obstruct the brain vessel, the phlegm heat. Maybe especially high cholesterol patient or diabetic patient. They like to eat all the durian or all the starch diet or meat, you know. So that's why create a lot of phlegm heat. A lot of now all the hotspot lah. Okay, next is blood stasis obstructing the channel. Blood stasis obstructing the channel means 血瘀阻经. So it's because of the stagnation of the blood flow. So due to a lot of blocking, you may say it's some obstructive, maybe arteriosclerosis etc. So our the treatment strategy of TCM try to invigorating the blood in order, because different type of patient have different types of syndromes. So that's why we will treat patient in a different manner, not in the same manner. Okay. So normally we use a herbal like 天麻钩藤的饮天麻五阳还母汤浙干溪风汤，还有地坛汤。All this is a recipe, is a herbal recipe. For acupuncture is 百会啦、风池、曲池、足三里、合谷。All this is just for reference, yeah. But not all the patient will do the same. First thing, we must know how to differentiate they are in which syndrome. So integration of the TCM of modern medicine, I think some study have done a lot of study have been done in China. They divide because they have a lot of sample. In China, they have a lot of stroke sample, means a lot of stroke patient. So their study is more than 1,000, 2,000 patient one. It's not like 100 patient as a sample. It's a very huge sample. So their study is quite relevant and convincing. So they have divided to the 3 groups. One group is just solely with modern medicine. Yeah. Another group, second group is solely with TCM, means only using herbal and acupuncture to treat the patient. And the third group is combination group. So they found out a lot of studies found out combination is better than lone ranger, means only modern or only TCM. So this is the I think it's evidence. So a lot even WHO also encourage patients to use the combination integration of TCM and medicine in terms of stroke management. But of course, I think who will come first, who will do in what stage, in which state. Of course, this one in China they have, because most of the doctors they have been doing both medicine. I mean, they have already cooperating for a very long period, so they know when is the which stage or when the TCM must go in, or when must modern medicine must go in first. They know they already work out in very good manner. So I think basically what I want to share today, that's all. Maybe anybody have any question, or we can discuss here.
Come here. Oh,
any question?
Go up to tree and then go with up. Go up. Walk properly.
Please mute your mic if you're not asking a question, Kelly or
Wake up.
Any question from the floor? Or from chat? Let me see. Please mute your mic. Thank you. Can you have to blow your herbal medicine, or they come in capsule or powder form? Miss Chong or Mr. Chong, okay. I think herbal medicine, the best herbal medicine is in the boil form. I mean, in the liquid form. It's not in the capsule or powder. But of course, capsule and powder is more convenient nowadays. It's more convenient to consume. Why I say the liquid form or you boil the raw herbs, is better, is because is more flexible for TCM practitioner to adjust the dosage and to adjust the types of the herbal in the prescription. Yeah. So in China, normally they use the boiler one, not the capsule or powder. So that's why they always ask patient, or even the hospital itself in China, they blow the herbs for the patient. Once the patient seen the patient, they will ask them to come back maybe after 1 hour or 2 hours. Then they will get ready and packing and then pass to the patient. Any question? You may open your mic and maybe you can talk to me also. No question?
Hello, doctor.
Yes. Who is speaking?
Is there? This is Tim.
Okay, and that's Tim. Yes.
Is the Creole oil good to avoid stroke? The Creole oil, the 磷虾油.
Sorry, come again.
The Creole oil, 磷虾油, 虾油. 虾油, 磷虾油, Creole oil.
磷虾油啊？
虾油, Creole oil. Can it avoid stroke? Can we take it to avoid stroke?
All these nowadays a lot of supplement. Okay, try to reduce this, reduce that, or try to prevent. I mean, stroke is not a single risk factors illness. It's a multiple risk factors. All these supplement only can reduce maybe a certain of the risk factors. It's not all the risk factors. So that's why I would not say it can prevent, because stroke actually not only a single risk factors problem. So all this oil or all this, maybe we can increase a good lipid to reduce the cholesterol. Yes, I mean a lot of the statin medication also can do it very well, but I think nowadays, as I say, first I think what is the best way to prevent stroke? I think go back to the basic. Go back to basic. You must have enough sleep, enough rest, yeah, and must have a good tempo, yeah. Don't be bad tempo, yeah. Good rest, good tempo, and diet must have a very good proper diet, yeah, and then must have certain exercise. I think this is the best way. Even the cholesterol, there are so many studies, especially the bad cholesterol, LDL or non-LDL, try to reduce. Even there are many studies, they have proof that exercise is the best way to reduce the cholesterol, to reduce the blood sugar, even the hypertension. So I know the claim. I heard about this, but I mean, I would not say eat well to avoid stroke. If I want to consider it can avoid stroke, there are many ways can avoid. Even a lot of supplement can avoid. But how good all these supplement also, you may see. Just now we can see the graph, the China one. Why China? You see, even they are practicing TCM or herbals. Why China? Why still so high? Death rate is not the occurrence, is not the morbidity rate. actually it's the death rate, mortality rate. Mortality means die, die from stroke, means it's very serious. So what about morbidity rate? Morbidity means illness. How many patients? There are so many patients. You see, I think nowadays stress also very main. Stress is the main factors. Stress. Yeah. So okay. Any question? Fresh or dry better? Fresh or dry? Or what do you mean fresh? Oh, the herbal. Now, if all the Chinese herbals, I mean, normally already dry lah, no fresh lah. Normally, I mean, if you get from the Chinese herbal shop, normally it's dry already. But it doesn't matter dry or fresh. Actually, the most important is from the original place. Yeah, and it is true. It's not the good quality, because nowadays herbal also facing a problem. The truthfulness, the quality also is a challenge. I mean, nowadays China side also doing a lot of things to make sure the quality, for especially for all these plant, how they plant it, how they improve the efficacy of the herbals. They are doing a lot of things now to improve that. Hello. Any other questions? Have anyone gone through acupuncture treatment before? Everyone tried before acupuncture, but I mean, I heard some patient, or some of my patient, they thought that some people say acupuncture no issues. Some people say acupuncture very good in stroke management. I think if for acupuncture treatment, I think the golden period is to improve the complication. I mean, the weakness of the limb, the speaking. I think the first 3 months, first 3 months is the golden period. Then after that, after 3 months or after 6 months, I would say don't waste time and waste money already. I think the first 3 months, first 6 months is very important. Because after 6 months, the brain cell or the nerve, it won't recover. After 6 months, it's already definite die. So the most important is the timing. And the second thing is the practitioner. Not because of the acupuncture treatment is not good. It's because of the practitioner who you look for. Is it whether in good skill or quality, in good skill or not? So this is up to your luck. Yeah, up to you how to judge it. Because acupuncture treatment actually like martial art. I always say that like martial art. If you want me to fight, punch one people, you better look for Bruce Lee lah. Don't look for me. I also know some martial art, but Bruce Lee is better than me. Correct? So it's up to you how to see, how to choose. Okay. Sudden death due to stroke. Is sudden death due? Yes, of course. Yes. Yes, sudden death due to stroke. Yeah. Can. That normally that kind of stroke is not ischemic stroke. Normally it's the hemorrhagic stroke. Hemorrhagic means bleeding, burst, the vessel burst inside the brain. So if small vessel burst, actually the recovery rate is very, very high. Even he can become like normal people maybe after 1 week. What I mean is small vessel burst, very, very tiny vessel burst. It will cause some stroke, but the recovery rate is very high. But normal sudden death due to stroke normally is the big vessel. So once big vessel burst, very hard to stop. So cannot stop. So that's why doctor, if you go to see doctor, emergency, so the doctors will not, first thing they try to stabilize, and then maybe they take out the scalp, the scalp bone, try to reduce the tension, the scalp bones. That's why you can see some stroke patient, the scalp bone has been removed from the head. You can see some sunken part. So it's from the sunken part, of course, don't do any pressing or any acupuncture on that area. Very important, because that area only the brain itself only covered by a skin, the scalp skin. So if you press or you use needle to poke in, it will go straight to the brain already. Okay, so that's why sudden death is due to bleeding. Very hard to stop. Infrared light therapy also help to cure stroke. I would not say cure. This word cure, stroke is very hard to cure. Maybe can improve. Improve the complication in order that's why we use a rehabilitation words. Rehabilitation means we can improve back his function, his limb function. But of course, the function is not so like normal function. Maybe some slowness, but or maybe stiffness. But as long as he can become independent, that is the purpose of the rehabilitation. So infrared light therapy can reduce some inflammation, can reduce some swelling of the brain, of the part of the stroke. Means sometimes when blocking, vessel blocking, acute ischemic stroke, the part of the blocking side sometimes will swelling because of the pressure, and then force the liquid from the vessel go to the brain's area. I mean extravascular area, and cause edema. Maybe infrared may reduce. Of course, while doing rehabilitation, may reduce the inflammation process and swelling. May help. May help. Now, even 30 years old man dies of sudden death. Yeah, age is no more. Yes, agree. Whatever you can do, I am 16 now. So far, have the congratulations. You have bonus, more than 32 years bonus than them. Good. So I think the most important is I always talk to patient. Sometimes we must ask ourselves why we must live so long. Of course, live long is good, but I think it's not the length of the life. It's not the year. Yeah, I think life is we cannot judge by how old. I try to make our life more meaningful. It's not because of how old we do. Doesn't matter. Short life also doesn't matter, as long as it's meaningful of life. But of course, we must take care of ourselves. I think the most important you take care of. But nowadays, a lot of people, young people, is because they chase money, chase for wealth, chase for I don't know. I mean, not necessarily thing, sometimes, or maybe sometimes it's because of stress. You see, nowadays, all the cyber bully, you see, nowadays, that's why I normally I don't encourage people to comment anything, without any doing any research. We want to comment is very easy, but sometimes our comment indirectly to hurt the people or make the people suffering. We don't know, but of course we must try to comment good comment. Good comment normally won't hurt people, especially bad comment. Yeah, especially bad comment. You must think twice, or not think twice, think 3 times or 4 times before you do the comment. Yeah. Especially doctors, I think I shared before, even doctors also, sometimes some doctors, it happened before, this real scenario. An old man asked a doctor, young doctor, say whether my illness can be cured or not. I don't know whether because of the young doctors say something, maybe, your problem it cannot cure one, like this, no use. I think like this, make him, he feel disappointed, and then he jumped from the hospital, I think 4th floor, go jump down. Luckily, ground floor is an emergency department, and then save him. So what I mean is, our mouth, our hand is a weapon, Our mouth and our hand is a weapon. This weapon can be to save people or to kill people. Okay, this is more philosophy question answer. Our patient, I mean, stroke patient, there are many young patients. Yeah, many young patients. Any question?
Dr. Kong, I have a question.
Yes, please say.
There is once told to me by a doctor, a trained doctor, that high cholesterol is a very early indication of possibility of stroke in later life. How much truth is there in this statement?
Oh, cholesterol. Okay. Normally I would say, doctor always say tiga serangkai or tiga, what is the 3 main illness, chronic illness: hypertension, diabetes, and cholesterol. This is the 3 main chronic illness to cause a lot of problem. But let's say if you have only cholesterol problem only, I think the risk to get any type of problem or heart problem or stroke very less. Don't worry. Don't. If let's say you have cholesterol, then you have diabetes, then the risk is much higher. If you have 3 hypertension, and then to get, it's not. That's why I say stroke is not a single risk factors illness. It's not a single stress, a single risk. It's a multiple. But of course, indication, of course, what doctors say, maybe his meaning is to try to low down the cholesterol. If let's say cholesterol only, total cholesterol or LDL, the borderline, I think it's okay. I think the most important, you may go through exercise, diet control, Okay.
Thank you.
Welcome.
I have a second question.
Yes.
Being a carer for a stroke patient, we find that the patient normally has a very depressing outlook of life, very negative.
Okay.
Probably because they suddenly feel that they have been more dysfunctional as compared to before.
Yes.
So this is a general question, not really a medical question. Is there any approach, that carer can give, can implement, to help to alleviate this depressive thoughts from the patient? Is there like maybe any herbal medicine that can lift a person's spirit, something like that?
Okay. Chinese words 心病還需心藥醫 It means if you have a mentality problem or psychological problem, I think the best way is from psychological way lah. It's not from herbs or from if you want from herbs maybe you can use morphine or this, but even some no lah. I mean it's not good lah. So that's why they run away from drinking alcohol or smoking. I think this is the bad example lah. I think the best way is a support, support from family members, from friends. I think the support is very important, and the caregiver. I think the most important is from. So that's why I say we must become everybody here. I hope everybody can become the positive energy to whoever surrounding us. We must become that kind of person. Actually, we already saved a lot of people. Anyhow, how good or how advanced the medical technology or knowledge we see, I think a lot of problem also we can't solve the problem because the more and more modern illness, especially all this depression, stress. Okay,